What pain symptoms are you experiencing right this moment?
Oh, it's all over here and all over here, but then I have other pains on my legs and all that.
When we talked the last time, you mentioned tightness in your throat. Do you feel tightness there now?
Yes, I do, in my whole mouth, actually.
Any pain at the top of your head right now?
Right here, don't I? But you know it goes up here this way, don't you?
Mm-hmm.
I treated it with biofreeze this morning.
Okay.
Because it seems to help, but it goes like all the way up like this.
And today, have you taken any pain medication at all?
I haven't taken any.
Okay. The pain that you're experiencing in the back of your head where you just talked about it, if you could quantify that on a level of 1 to 10, with 10 being the worst pain you could imagine, what number would you put on that?
Right now I put it at 10.
Oh, wow. So you're pretty uncomfortable right now.
Uh-huh.
Okay. The shoulder pain, would you put that at the same number?
Yeah, actually I would. This whole pain and everything I would put under there, because I was thinking maybe I should take a pain pill, but then I thought sometimes when I go to doctors I won't take anything before I get there.
Turn your head to the left as far as you comfortably can.
Oh wait, just my head, huh?
Mm-hmm. Okay, and now to the right. Does it hurt to do that?
Uh-huh.
Okay. Now tip your head to your shoulder on that side.
Oh.
Is that sore?
Oh, extremely so.
Now the other side.
Yeah.
Okay, all right. Okay. I'm going to hand you this cup of water. And just take a couple of sips and tell me what that feels like to you.
Okay. Oh, it doesn't feel good. And the last one was hard to do.
Tell me more about that. When you say it was hard to do, does that mean painful or just it takes work?
Oh, it doesn't take, I mean, I'm at the top of my pain, but it takes work to get it down.
Okay. So it's not easy to swallow.
No.
Okay. You'd like to see how the orthotic is affecting your breathing and your oxygen levels. So right now, your baseline oxygen, just sitting here, being relaxed and breathing the way you normally breathe, it's going to bounce around a little bit. It just had dropped down to 92, went up to 93. Now it's at 94. So now it's at 93. So it's going to bounce around a little bit, just depending on your breathing. Give you just a sip of water.
It's easier to swallow the water with that.
It is?
This then, yes.
Okay. It's probably going to be a little hard to talk until this is better adjusted. Again, we've just barely started. Do me a favor and turn your head to the left.
It's kind of kinky there.
Kind of kinky there. Now to the right.
Right feels a lot better.
Right side feels better. Tip your head to your left shoulder. And now to the right side. How does that feel?
When I tipped it that way, it was okay. When I tip it this way, it pulls.
Okay. Okay. How about the pain in the back of your neck?
It feels a lot better when I have this in.
How is your overall level of pain right now?
My overall level of pain, probably a 7.
Okay, so we've gone from what you called a 10 down to a 7. Let's have you turn your head to the left.
See, this is pretty good.
And now to the right.
Yeah.
Okay. Now tip your head from side to side.
Oh,
How is that feeling?
okay.
Do you feel any tightness in your throat at this point in time?
No. My throat itself. No. I'm swallowing better.
We are at the end of about an hour and a half's worth of adjustment of this orthotic, and let's kind of summarize and go back over what you're feeling right now. Right now our oxygen levels have come from 92, 93, 94, kind of bouncing around between those numbers up to 98. I'd like to hear from you how you're feeling right now.
Okay, I am feeling much better than when I came in. First of all, my pain level that was affected my neck. Of course, I have residual pains other places, but my neck is like totally loose, just about, as far. I consider this loose because I couldn't do that before.
Let's have you swallow and see what that's like for you right now. Is it easier?
A lot.
Before you had quantified your pain level that you were experiencing at a 10, I believe you said.
It was.
What number would you put on it right now?
Maybe a 2. But it keeps going down. It keeps feeling better.
Okay.
So, I don't know.
Can you tell any difference in your breathing at all? What are you noticing?
I can breathe through my nose now. And I'm not forgetting to breathe.
Okay.
I would forget to breathe. I don't know why I learned that, but,
You mentioned that you can breathe through your nose now. Breathing through your nose is not a common thing for you?
No.
When is the last time it's felt this easy to breathe through your nose?
Oh, I can't remember.
Days, months?
Probably years.
Years? Okay. What I heard you say earlier was that you're more relaxed than normal.
Oh, yeah.
So this amount of relaxation is not common for you? Is that what I'm hearing you say?
And, like I said before, I stopped breathing, and I realized I stopped breathing because somebody told me. I say, take a breath, And but right now, I am subconsciously breathing again.